Good afternoon, everyone, and welcome to the City of Alameda Mayor's COVID-19 Town Hall. I'm Sarah Henry, the city's Public Information Officer, and I'll help moderate today's event. Please note that we have 2 American Sign Language interpreters joining us today. ASL interpreter 1 to 130 will be signing through the first half hour, and ASL interpreter 130 to 2 will be signing during the second half hour. You can click the 3 dots to the right of their screens to pin their screen so that you can see them and have them up the entire time. Mayor Ashcraft invited special guest Dr. Karen Tribble, Director of Alameda County Behavioral Health Department, and Dr. Cale Jenks, Director of Alameda Family Services School-Based Services Program, to join us today. Please note, all participants have been muted. To submit a question, please use the chat feature. Following their opening remarks, the Mayor, Dr. Tribble, and Dr. Jenks will be available to answer your questions. I'd now like to turn today's town hall over to Alameda Mayor Marilyn Ezzy Ashcraft.
Thank you, Sarah, and welcome to our special guests, Dr. Tribble and Dr. Jenks. I'm so pleased to have you, and hello to all the audience that is out there. I miss seeing you in person these days, and hope you're doing as well as possible under these challenging times. And the reason that I wanted to have mental health be the focus of my COVID-19 town hall this week is that, you know, we are 1 month into the stay-at-home, shelter-in-place orders that we are abiding by order of our Governor Gavin Newsom and our county public health directors. And that would be the public health directors of the 5 most populous Bay Area counties and the city of Berkeley, which has its own public health department and director. And this is a good thing because we truly have in Alameda County and in the state of California slowed the spread of COVID-19. Our hospitals are not being overwhelmed with seriously ill COVID-19 patients. We are managing to have enough supply and equipment. Most equipment, I hear this week we're short on hospital gowns for our medical providers. But all in all, and certainly compared to some of the states we're hearing about on the news, we have done relatively well. And it is because all of you as a community are acting together and exercising that self-discipline to not go out in public except for essential activities. When you do go out to do your grocery shopping or pick up a prescription, you're wearing your face mask and you're washing your hands frequently and well for 20 seconds often. That's the good news. The bad news is it is hard to be cut off from other people. In fact, we've started using the term physical distance to talk about those 6 feet that should separate you from the next person, unless it's someone in your household. But we don't want to say social distancing because we need social interaction. And we're just hearing, a little bit about more anxiety and depression and children acting out, and not surprisingly. So as mayor, I like to say I know what I don't know, and I don't know a lot about these topics, but we are so fortunate to have 2 experts close at hand. And the first one we're going to hear from in just a minute is Dr. Karen Tribble, and she is the Alameda County Director of the county's Behavioral Health Department. She'll tell you a little more about what she does, but I can tell you I've enjoyed going to the county's website and listening to some of the YouTube videos she's recorded, not just about now during COVID-19. I really like that one about during the holidays, even though I listened to it recently in spring. A lot of good advice there. And then Cale Jenks, and I have the privilege of sitting with Dr. Jenks on the Alameda Collaborative for Children, Youth, and Their Families, which is a collaboration of many different social service agencies, the schools, the city, and we look at issues impacting children and families. Well, Dr. Jenks, in his day job, he is a psychologist, but he directs our school-directed counseling programs in our schools, so working with young people. Now, of course, he's not seeing his clients one-on-one in the same room, but he'll probably tell us about how he's doing that. But I asked Dr. Jenks to join us today to talk about issues that are specific to young people. I mean, we think about all the high school seniors, the class of 2020 that is having a very different experience than many. But anyway, that's enough from me. I'm so happy to have you all here. And I am delighted and honored to have Dr. Tribble take some time out of her very busy schedule to join us. So please, Dr. Tribble, tell us about the items that are top of mind for you. And I know you've got some great advice for all of us. Thank you for being here.
Well, first of all, I thank you for even asking. I think this is such an important topic, and I'm very pleased to be part of it, and I'm happy to help in any way that I can. One of the first things I wanted to just start is without saying much about it, because I hope this forum really allows you all to do much of the talking and asking any questions that we can provide clarity on. But just a little bit about me. So I actually am a little embarrassed. I did the calculator, and I've been in doing either research or in the behavioral health field about 27 years now. And so the gray hairs are not highlights, they are earned. But what I think has been helpful, and why I even say that, is because I actually was a leader on the East Coast. I lived in the East Coast and was there, and an executive director and leader back when we had 9/11. And I say that to say the impact that we are seeing is different, but I do want to acknowledge it is significant in terms of what we expect now, what people are going through, and for a variety of reasons. But it struck me in a palpable way that we're going to be going through some things. So the first thing, I know that some of the areas that I have heard are very interesting topics that are just important to talk about are around social isolation, suicide, or that risk, and some of the issues that we're having in the county and that you can expect to have. So the first thing I want to just start off by saying is, as you know, in the news, you will hear constant references to mental health and wellness and behavioral health and the impacts of social isolation. So I want to acknowledge that. But I think what's helpful is I want to unpack what that means. Because as you know, many of us are now getting very connected on different types of media platforms. I still don't know how to do it, so I'll have to call my 20-some-year-old or my sons to help me figure out which button to push and which not, and where not to push, and which is interesting in and of itself, but I think it's a little more than that. One of the things that I think we've been adept at doing, and what we're seeing, is that people are learning how to use their phone, how to connect, how to keep in contact, how to get that information. But what I would encourage people to do is to take a step farther, is when we're looking at, certainly there's the physical distancing, which we acknowledge, but there is a different type of social change that we're experiencing. So when you're at home, one of the questions that I often get is what can we do? And I have in many different forums, even with our own staff, my leaders, talked about certainly looking at the things that give you joy, obviously, things that are creative. But I think it's a little more than that. So in a given day, if we didn't have to socially isolate, one question that I think is important for us all to ask ourselves is, what would we be doing? If you're able to be in the community, or if you are a person interested in crafts or shopping or grocery store, if there is a schedule of things that you do socially just as a human being, keep that in mind in terms of what it feels like to not be able to do that. And so why I say that, it is beyond just the limited ability to connect. It is literally, there's a physiological change that our bodies are experiencing when we're not able to do what we used to do. Whether that's exercise, I'm sure many of people have heard about the number of poundage that we all might go through by being a little more isolated. But again, it's more than that. If you were one who typically had a structured, I get a cup of coffee, then I take a walk, then I walk the dogs, whatever that looks like, and you've actually have to now be heightened and more aware of what you do and how you do it, you're actually triggering different parts of your brain. You're actually, if any one of us are looking at the TV for 2 minutes, more than 2 minutes, are inundated at every turn with messages that are not fun. And I say that to say is we're not meant to be in that sustained level of heightened awareness for any significant amount of time. So when you couple that with the fact that we can't go through a normal routine, we can't connect, we can't touch, we can't do everything the same way, there is a normal reaction to that. Again, what's interesting is a lot of the media, and I'm blessed to, on Wednesday, we happen to be able to sit down with some members of our legislature, senators and assembly members, and helping them to understand it doesn't just mean when you're talking about mental health, a clinical syndrome. It could be, but what we're anticipating is long after the changes have been lifted, our bodies will have to readjust, and we'll have to refigure out what our normal was. And those of us who are mostly healthy will have anxiety, we'll have depression, we'll have sleep disturbances, we'll want to eat a little more cake, we'll want to do some things that are unusual, maybe frustrated, maybe perseverating, literally doodling for no reason, or you'll, as soon as you connect with someone, i.e. Skype, and I'm one of those humans that will do it, you'll start to doodle, or you'll start to be distracted, you want to text. And I'm just here to say that that is a normal physiological response to the body trying to adjust to this. It really is a trauma. The other piece is that I found be very helpful for folks is for their own self-awareness, because many of us parents or even caregivers or just friends, is that you really want to make sure that you're okay. Also, very much like on an airplane, you want to make sure you're okay, but then connect with others, which is absolutely correct. But there's some insights that you don't have to be a clinician to grasp in dealing with this. So for example, if you are one of those folks who are finding that you're eating more, or you're smoking, or you're having to exercise so much so that maybe your partner is laughing that you're burning a hole in the treadmill and you kind of need to peer back. If you can just think of, what am I needing right now? What is my body craving right now? So for example, if I often went shopping, I love to be creative. Is there a different way that I can be creative? For my own, again, I really say these are very helpful strategies. For my own kids, my daughter went wild and made masks, a dozen of them. They're all over the house, so we probably can mask our dogs. But it was helpful because she was one of those creative geniuses who needed to kinesthetically move. Same thing with if you're finding yourself eating too much. Again, it's just thinking, what am I needing right now to feel comfortable? So then what makes me comfortable? Is that meditation? Is that reading? Is that writing a book? What is that? Is that connecting to my family? So if all the things that I mentioned now, you forget, it's thinking about when you're starting to feel that feeling of discomfort or frustration or anxiety, really pinpoint, in a normal situation, how would I deal with that? Because this is everything other than normal in terms of what we're all wrestling with. There are lots of different avenues that you have available to you in terms of the community and what we're doing as a behavioral health department and supporting different systems. We have, and I'll be frank, we have seen an increase, according to our sheriff's department's statistics, an increase in domestic violence. And it is a different type of domestic violence that we're seeing in the sense of not the traditional individuals who might engage in the frustration, but it's compounded with loss of job, loss of everything. One of the things that I also hope and help people to really look at is you will, and others will around you, will want that daily inoculation. I do myself, or maybe you, of information of what's going on in the world, who's in charge of what, who's calling the shots, how often will we, or when will we be able to reopen, and what's the strategies for doing that? There's all these questions. And one of the things that I would encourage, and I have, those individuals who actually have been in the military, it's a strategy, and I don't want to be melodramatic, but you have to think we are actually bunkered in place, and there is a global kind of war that's occurring in terms of our bodies, our loved ones. We're getting inundated with information. And so one of the things that are helpful to do is to think about that which you can control. You've probably heard a lot of people talking about unplug and not to oversaturate yourself with information, but there's a theory behind that. The thought is that if you can isolate and in any moment, maybe some action steps or things that help you feel centered, I would encourage you to do that. If you look in the mirror every day and you think, I got to find out what's going on with COVID, I would encourage you to not. I would encourage you to breathe for a minute, center yourself, and just limit the scope of your day to moments or even an hour, or even, are there parts of my day that I'd like to devote doing this? Are there parts of my day that I'd like to accomplish this? It literally is, what can I control? What is within my control? And what am I able to affect in terms of that? Because otherwise, our world really are upside down and topsy-turvy. So that really ability to titrate information or titrate your expectation of yourself. And that's why I mentioned that in the terms of domestic violence, is because, again, we are clearly having individuals that are not able to work, that are not gainfully employed, or that are just insecure about their employment, as well as everything else. And some of the everything else buckets are around those who, i.e., may be either retired or working. But many of us notice our shopping bills have gone up tremendously. And I don't know about you, but when I went to Costco, I breathed and deep breathed and breathed again beside my husband sprinting down aisles getting toilet paper. Don't know why. But besides that, the amount of information and materials that we need to feel safe is increasing, whatever that looks like. And again, that is clearly affecting the way that we can manage ourselves and manage through this environment. And I think I don't want to go into a soliloquy. It's always interesting when you're muted, you can't hear anything. So I'm just singing basically. But I think the other point that I wanted to remind folks is what we're also seeing in the county, as well as across the world, is a need to basically organize what you're hearing. Some are finding that means, is there a blame? Is there a cause for this distress? Is there organization? And what I would encourage people to think about is very basic mechanics. I'm sure folks have heard of the fight, flight, or freeze response. Have people heard that? And our bodies are not made to fight for a sustained amount of time. And a very basic way to describe that, if you imagine a young person, and I will defer to Dr. Jenks, who I know will be talking about some services and supports available to youth. If you think of a young adolescent male who's so frustrated, embarrassed, and can't do anything. And what do they often do? They will cry. And why I mention that is it is an intense reaction of the body, basically not knowing what to do, wanting to do much, but cannot. And again, when we're in this self-imposed prison for the right reasons, we are all doing this to help our community and the world and all our loved ones that are impacted. When you think of how we react and you react, be careful not to stay too much in the fight mode. And again, I'll be specific. So you're watching whatever news channel that is, and you see images, and what you want to do is throw a sock at the TV, or you want to say, why don't those, folks do this better? Or I can't believe, how could those people react that way? How could they blame other people? There's just a lot of anger and frustration. Anger is galvanizing. It helps us to act, but then you have to think about the things that I said earlier. How then can you react? What things can you do to help you feel motivated and still in control? How can you contribute? Whether it's my daughter making a mask, whether it's us doing a scavenger hunt on Easter, because there's no other way to really embrace ourselves in terms of that. But whatever that is for you, because physiologically the body is not able to tolerate distress for that long without it then in turn infecting us. Whether that's your blood pressure, whether that is your eating habits, whether that is your sleeping habits, the worry, things like that aren't helpful. And at a very basic level, it's disruptive to our ability to recover from disease or even fight off. So ironically, as we're trying to shelter in place to be safe, the normal reactions that you feel as a human being to the plight of the world is impacting us. So just being aware of, I need to create a different space for myself right now to cope. Because literally anything you can do differently to look differently and really take care of your mental health and the ones around you, it really helps you to not only fight off the coronavirus, but it really helps you long-term to start to recognize what may help you kind of walk through this process. So I know I've said quite a bit, and I'm not sure where we are with time. So I certainly can defer to others or provide more information.
Sorry, I just realized I'm not in control of everything. Sarah has to unmute me. Thank you very much, Dr. Tribble. That was very, very fascinating to listen to, and I think we can all relate to a lot of what you said. Before we go on to Dr. Cale Jenks, I also want to let the audience know that over on your screen, if you go down to the bottom, at least on my computer, you'll see something that says chat. And if you want to submit a question, just type it in. Our moderator, Sarah Henry, she's our Public Information Officer, is processing all the questions. And then after Dr. Jenks speaks, I might have some questions for each of you, but you all can submit your questions as well. So with that, we would like to hear from Dr. Jenks from your perspective and the clients that you see.
Of course.
Welcome.
Good afternoon, everyone. I'm honored to be here and speak with all of you. My name is Cale Jenks. I work with Alameda Family Services. As it was shared, I'm the program director of our school-based services. I've been with the agency now for 11 years, working with youth in Alameda, ranging from elementary through high school. When I was asked to be able to speak today and share about youth experience, I immediately connected with my staff because I wanted to present on what is specifically happening here on the island with the youth that we are working with. I'll start by sharing that I'll be speaking from a unique perspective because the majority of the youth that we are working with, they are already a vulnerable population before COVID happened. Our clients were referred because of emotional difficulties, such as depression and anxiety, struggling connecting with their peers, emotional regulation, and learning disabilities. And so there are so many unique ways that these youth are now being impacted with the stay-at-home order. And so I've tried to narrow my talk to a few main factors that are present in youth and obviously be able to answer any questions that you all have at the end. Before I dive in, I also want to share and highlight that class and privilege are greatly impacting how our youth and families are managing this. And as Dr. Tribble had mentioned, finances are a very major stressor for the youth as well. For some families, youth having a job was not only a lesson or an experience in responsibility, but a means for living. We are currently working with some families where the entire household has lost their jobs. And there's so much anxiety, concerns around when the stimulus checks are going to come in. And so you're seeing youth not only be impacted by what they were going through initially, but also from the family's own anxiety about how they're going to manage. For the most part, for the youth that we're working with, the presenting problem that brought them into services is still there. And in fact, it's been exacerbated. Depression, as one would expect, has continued for many, and in some cases worsened. Isolation is not only a symptom of depression, but is a precipitator. And we talked about social isolation and how that impacts people. And you have some youth who are staying in their room and are no longer encouraged and supported and being able to go out to school and interact with their peers. And so that is having obviously a negative effect. Anxiety has been the most interesting issue when I talked with staff. For some youth where the pressure of school was causing so much anguish, it's actually decreased now that school has moved to distance learning. The school district has worked so hard with the state superintendent and everyone to be able to have school be less of a burden with the pass and fail. And so we've seen a decrease in symptoms for those youth. But for other youth who have more of an overall general anxiety, it's heightened as there are so many unknowns around what's going to be next. Loss of structure and stability is the next piece I wanted to touch on. Many parents and youth have been shocked at realizing how much structure and stability the schools provided. It wasn't just the academics that the school was providing, but recess, lunchtime, socialization, knowing not only when you're going to eat, but that there's going to be food that's available. After school programs and sports, all of these things were scheduled into their lives, and now they've disappeared in a vacuum. And so, you know, for many of the youth that we were working with, it wasn't just support from the school, from the teachers that they were with and their peers, but these students had speech therapists they worked with, a paraprofessional, enrichment, tutoring. So for many of them, they didn't only lose the structure, but there was a significant loss in the daily supports they were accustomed to. We have a youth development group with Alameda Family Services working out of our school-based health center, and we've been working to put together videos to share how youth are experiencing things from their own voice. And a lot of the older youth in the video were realizing that having nothing to do is actually not all it's cracked up to be. You know, as Dr. Triple said, they're finding that they're very bored, and they're having to be creative and find ways to engage. And for some youth who are heavily impacted, it's hard to find that creativity. There's also been a loss of experiences. I believe Mayor Ashcraft had mentioned graduation for the high schoolers, but it's not just our senior class, it's our 5th graders and our 8th graders who were looking forward to the 5th grade versus staff kickball game, or the 8th graders who were looking forward to the Disneyland trip or prom. These things that were, you know, so important in a youth's life to be able to have, and now really processing with our staff around the loss of that and not being able to have that experience. As we all know, peer relationships are so important, and for many, they have lost that connection, the ability to physically be with others. As was mentioned with social distancing, moving to physical distancing, we're always trying to encourage youth to be able to connect with their peers. But that ability to connect is impacted by so many factors. I mentioned earlier about resources, and you talk about someone being able to youth to jump on a Zoom call or FaceTime a friend. Some youth are worrying about using up their data plan, having access to a personal computer, having to share their phone among their siblings. It really is an area of privilege that would allow some of our youth to be able to engage in the ways that we're talking about, and some of them it's just not a reality for them. There's also the issue of privacy. It's not just being able to talk without your parents knowing your business, as they would say, but for some of our older youth, their identity at school is not necessarily consistent with how they present to their families. And so being able to be true to themselves and to their peers, that's kind of taken away. And though relationships are so important, there's also the impact of not having any time for yourself. When we talk about privacy, it's also privacy in having like a physical location to just be alone. And we have some families where there's multiple families living in a single bedroom or even a studio. And so they just don't have the ability to be on their own. You know, I'm fortunate to be at home with my family, but I also have 2 young kids, and I have many of times when I'll be talking with some of my staff, and then my children will come in. And in my situation, I feel blessed that it's a positive thing, and my staff are, you know, get a big laugh when they see my kids. But for other people, it can be really difficult if you have a job where that's not a possibility. I do want to highlight though that there has been some positives that have come from this. Our therapists are having more family engagement than ever before. Parents are able to, and when appropriate, really engage in the therapeutic process. They're seeing their children through a different lens because they're able to work with our therapists and find new ways to support them throughout the week, really be able to take some of the work that's happening and then implement it into their family and their culture. And so I just want to highlight that though the first part of what I've been speaking about is some of the struggles that have come of this, there are quite a few positive things. A lot of youth have been sharing that they've been getting into cooking and just learning an instrument. So creativity is one of those things that we just need to be able to hold on to. The question I wanted to answer that I imagine people are going to ask is what to be able to do for your children. And For those looking to support others, I want to stress the importance of being able to take care of yourself. It's similar to putting the oxygen mask on in an airplane. You may not think it, but your children are highly aware of others' emotions, and obviously yours as their parent or guardian, and they may not say anything, but it's impacting them. So finding a way to be able to do things that are going to take care of yourself. And when we speak about self-care, self-care for our youth has moved from something that was essentially structured into their lives, class breaks, sports, lunch, things that I spoke about earlier. Youth are now having to really find a way and carve out time to be able to do things specifically for themselves. So our therapists have been working with their parents and the youth to be able to engage them in accessing mindfulness. There's a lot of great resources out there. Mindful Schools, which is an awesome program that a lot of my staff have engaged with. They released a 10-part mindfulness class for younger youth that's available on their website. We've been emailing over coloring pages and Sudokus and different things for the youth to be able to do. You know, stretching, going for a walk. If you have younger kids, being able to make it a scavenger hunt, journaling, doing yoga, exercise. It could be even as easy as snuggling with a pet, but just doing something that's going to be taking the time for yourself. And then I also have some resources that I was going to share out, but I don't know the appropriate time to do that. And so I'll kind of look to each of you.
Sarah, you can, do you have something, Dr. Jenks, to go up on our screen, or is it a website you want to share? Or
I was just going to point people to different resources that were available in the community.
Sure, go ahead.
I have
Sure.
on the website there's a COVID-19 page, and that COVID-19 page has a section called Self-Calm. And Dr. Jenks, if you could send me by email those resources, I'll add all of them to the Self-Calm section, and folks can get them there.
And the website Sarah is talking about is our city's website, which would be alamedaca.gov. And then, as she said, you will see the COVID-19 section, which is updated constantly because we're getting new information all the time.
I'll just take a second to highlight then that obviously Alameda Family Services is still providing services. We have a number of contracts through Alameda County to be able to provide to Medi-Cal beneficiaries, as well as funding from various resources to be able to provide services to students. And so therapists are providing services via telehealth, as well as over the phone if families aren't able to engage in platforms as we're all meeting together. And so just knowing that there are resources available, and I'll make sure that the information for Alameda Family Services is available on the city website.
Perfect. That's a big help. And so now I know I have a few questions I've thought of, but I think Sarah is getting questions from our listening, viewing audience here. So do you want to go ahead and send some questions out to our guests, Sarah?
Sure, I'll start, and then feel free at any time, Mayor, to ask your questions too, and then we can just go back and forth. I have had a few questions about the same subject, and it's actually a concern about somebody specifically in our community, one of Alameda's unhoused residents, and this person has been behaving very erratically during this time, more so than is typical. And they've been behaving violently too. And in fact, I guess there's one point where they broke a car window when somebody was in the vehicle with a skateboard. And so there's a lot of people that have expressed that fear, and a couple of questions has come out with this, and I think this is really aimed at Dr. Tribble. But how can behavioral health help us keep safe from this person? How can we not be afraid of this person? And what can be done to help keep this person safe? How can the county coordinate better with the city with regards to this person, and then in situations like this?
Excellent questions. I think first and foremost, we are essential services. And as was mentioned by Dr. Jenks, the background you see behind me is my office. It's a ghost town, but we are here, and the county and the community services, and I as a department head, we take it very seriously. The first response is crisis services. Crisis support services is available, and we can do, and we have been doing outreach to folks, particularly here in the whole county. So wherever that is, including Alameda, that's the first and foremost. And again, I happen to be walking down the hallway and seeing their cars around, and they have been dispatched and engaged. We've even had to redeploy other staff to be a support. So I think that would be the first thing. And I certainly can make sure that we update the website if you don't already have that number.
Yeah, we'd love that. We'd love that contact information.
Absolutely,
Excuse me.
absolutely.
Thank you.
You're welcome. And the second part of that is we have in the county, and we've, be honest with you, from the proactive nature of the state, we do have 2 different hotels that are established, and you probably have heard about them, but essentially 2 of them that are helping those who are unhoused. And either they are unhoused positive for COVID, or they are unhoused at risk for it. And we are also expanding that and have been emptying our shelters. And those individuals who even have some mental health challenges, we have wrapped around our services literally. So many of our contracted providers, we appreciate their flexibility, and they've been very nimble with us, really going to where the individuals are. So there is always a hand that we can provide. So I can certainly make those available resources, but that is what we suggest. And then on a very micro level, because of all the things that I mentioned before, as you can clearly see that this person may be activated based on what's going on and having a difficult time really understanding how to govern their own selves. That's normal. That we're seeing that. One of the things that we're trying to make sure we get the word out is because essential services is a vague term and most people don't know what that means, but it does mean behavioral health continues. 24 hours a day, we are open. So if you do need to reach out, or if people don't have their medications, we can make sure we have that available for them. You probably have already heard, sadly, people like the one you mentioned or others have mentioned, as you can imagine, there are things going on with our forensic population. So there's a two-edged sword occurring across Alameda County. Number one, to protect those individuals who may be vulnerable and have mental health issues, but because of their mental health status may engage in activities that aren't helpful and are unsafe in the community, like you mentioned. But what's happening is the law enforcement, and we're partnering with them, and I say royal we, it is a cumulative effort between us and our contracted providers that are literally going out, whether they're at Santa Rita, have been released from Santa Rita. So you're hearing a lot of news about people being released from jail, as well as if farther away in terms of that. But we're also wrapping around and providing some resources to those individuals. The complicated nature, as you can imagine, is that we do have a shelter-in-place order, but the flash card that we basically flash is we're essential services, so we can get out there and be a support.
Thank you very much. I'm sure we'll be in touch with you. The next question, Sarah.
Yeah, so this one is for you. To what extent is
Mayor.
the Alameda Police Department responding to reports that groups of people are gathering in areas of Alameda?
They are responding when you see someone out and about, a group of people congregating in a way that is not compliant with the shelter-in-place stay-at-home order, as in not staying 6 feet away from each other. What I do, if it's during the day, and it's kind of my nature, is I will walk up no closer than 6 feet and say, "Excuse me." I did this on Easter Sunday. My husband and I were out walking in a park, and we have put the word out and put signs up in our parks, wrapped the play structures with caution tape, and yet there was a mother and her little girl digging in the sandbox, and I had to go over and say, "Excuse me, you're not supposed to be here." And they just looked at me. Well, the mother did, the little girl, it's a sandbox. It took me a few tries, but I wasn't going away, and eventually she did get up and leave. But if you're somewhere and you just don't feel like you want to say something, and that's fine, you can call our police non-emergency number. It is not a 911 call, but the police are helping us to get compliance with this shelter-in-place order, because the sooner and the more extensively we all take shelter in place seriously, and really the majority of the community is, but those outliers can be carrying the virus. And so when you see something that looks unsafe to you, pick up the phone, call the dispatcher, explain, I am here at this site in front of this park, or, good description of where you are. Street address is helpful. And as best they can, they will send an officer out. I mean, bearing in mind that on any one shift, we only have 7 or 8 officers citywide. So sometimes, crimes have not taken a holiday. But if they're able, they will definitely go over, talk to people. We're warning first, we're doing education. If officers start seeing the same names coming up in the database, they will get a citation, and that citation carries a fine.
I think our next question is probably more for Dr. Jenks, although I think all of you, it's about funding, so it's appropriate for everybody. Will there be any special funding available to our aftercare program, small businesses who are being impacted but can't really do anything right now? Our small after-school program we go to is vital for our day-to-day.
Dr. Jenks, you could talk about what Alameda Family Services may know. It's we are now at a stage where the federal government made funding available through the Small Business Administration. There was the emergency injury disaster loans and the payroll protection program, both of which I understand have been depleted, but in the next stimulus package that is expected to come from Congress soon, there's expected to be more funding. So to the extent that this after-school program is a small business, and it might qualify as a small business, if they're talking about the Recreation and Parks Department, because our department certainly does have wonderful after-school and summer programs, we are so looking forward to getting back and offering these programs, but we have to wait for the governor, who is leaving it to local government. I appreciate that, but informed by our public health officials, to tell us when we are going to be open for business again. And as Governor Newsom, and I just want to throw out a shout out to our governor. We are so fortunate to live in a state, the most populous in the nation, but our COVID numbers wouldn't reflect that, because we have a governor who is smart. He's been proactive rather than reactive. He's worked with his public health officials, who've been working with public health officials around the county, issuing these orders, and our folks, all of you, are taking them seriously. But when he talked about the 6 indicators that he will need to see to know that it's time to start lifting the stay-at-home order, he also said it's not going to be like flipping a light switch on. It's going to be more like a dimmer switch, and raising it slowly, and maybe pausing or maybe pushing it back down if we see an outbreak of COVID happen again. So I know for the Recreation Park Department, these great after-school programs, well, school's out for there's no school for the rest of this school year, but say for its summer programs, after-school programs, next year, we just have to wait and see where we are. And the city is doing everything we can to stretch our budget, because we're feeling the pinch too. For a program like, let's just say, Girls Inc., I'm hoping that they can apply for a small business loan, but we're also, as a city, this week when the council meets, we're looking at various ways we can help our small businesses in town weather this storm. So you are not alone. I would say keep in touch. We know what we know now, and we will know more soon. But I would welcome hearing from my 2 experts. Dr. Jenks, do you want to start? And then Dr. Tribble, if you want to add anything.
No, I appreciate you taking the lead on that question. And unfortunately, I don't have much knowledge about other organizations and after-school programs. I am very thankful for Alameda County Behavioral Health the Alameda Unified School District, and the various funders who have continued to ensure, and the county supervisors who have made sure that our therapeutic services are still available, and that we're still being able to support the youth and the families. But as far as other services, I'm sorry, I can't speak to that.
No, that's fine. Thank you. Dr. Triple, did you want to add anything?
I think the only nuance I'll add, again, is you and Dr. Jenks mentioned, specifically to this county, we can be proud that our board of supervisors did authorize, at least for our department, and we took action pretty early on to provide essentially 1/12 of the contract payments that are
That's right.
provided throughout the county. And what that means for our youth services programs is they didn't have to go without. We knew that our schools are closed, and we knew that's predominantly how they get their funding in order to continue to do the service, but they continue. And the other thing that we did was we changed to knowing that there's a lot of other complicated nuances, but we shifted our requirements to enable all kind of contact, telephonic, outreach,
Yes.
everything. So we loosened every restriction as a policy and a governance that we could, clearly approved by CMS as well. We couldn't go too rogue in the Bay Area, but we enabled that to happen. And I say all that to say that even if there isn't a structured after school program at a particular location, we've got our providers on tap. So if anyone reaches out to our access and gives a call, we can potentially quickly find a number of providers who are more than willing, because again, they're affected by our shelter in place, to go out and outreach and provide some kind of support to those individuals. So we've just tried to just be ahead of everything that we can imagine to loosen the restrictions. So I don't know the particular provider that may be there. I am familiar with Girls Inc. Offhand, I won't go into detail lest my finance director tell me to stop talking. I haven't moved enough. Am I
Oh, did your light go off because you didn't
it
move
went
enough?
out. It was not existential, but the lights are still here, I hope and pray.
No, we
But
can
yes,
see you.
that would be my response. If there's a particular need, that we can certainly be reached through our access line, who can quickly engage. If there's a particular person, that makes it even the better. But we pretty much have supports and services in every school across the board in the county.
Very, very nice to know. Thank you. And yes, I love that there is a fine distinction between being nimble and being able to pivot quickly in these circumstances and going rogue. We try to stay just on the other side of that line.
We try not to be on the news in Alameda
Right.
County as much as we can.
That's right. That's right.
Yes.
Sarah, what else have you got for us?
So here's a question for everybody. What advice can everyone share for working parents who are now having to juggle the job of childcare and a full-time job? This person in particular has an infant, so their child needs constant supervision.
Oh my goodness. I am going to defer that one to my experts here, because I happen to be my husband and I are now empty nesters. Although we did have a sweet experience this morning. Sarah's heard me say this before. I try to do a 7 a.m. Zoom yoga class as often as I can on Friday mornings. And I have a child who lives overseas, and yet when she's able to, she joins the class and I can see her up on my screen. And it's just, there's something about seeing your child and you just think, yep, she looks good. Anyway, but for Dr. Tribble and Dr. Jenks,
Yes.
I'll bet you're hearing these issues. What advice do you have? Dr. Tribble, let's start with you.
Absolutely. And from we are now 6 of us in my home. So I was recently told by my teenage son that we shouldn't eat dinner at the table because we're practicing social distancing. So we'll eat dinner at the table.
Spoken like a teenager.
Yes. So it ranges 20-something to 8. And my husband and we're tripping over each other and our dogs and fish and everything. And we're both being teachers, which neither one of us, I happen to come from a family who also have educators in there, and I'm not a teacher. And we've also had to learn Zoom. To have an 8-year-old on a Zoom meeting at 8 o'clock in the morning is interesting, to say the least. So the advice I would say is, number one, I'm using levity for a reason, not to belittle it, because you and I and others are going through the same thing, but to remember that the good thing is the school districts, and again at the state level, recognize this is very difficult, even in the small infants. And I would say for those of you that are wrestling with whomever and how old the child is to think of the type of structure you can do as much as you can. There's a psychological term called chunking, which essentially just means you break up a task. Mm-hmm. And I would think if you're having to work from home, I would think of your 8-hour workday as you used to work, and blow that up and think of how you can fit in parts of your workday that really fit like a puzzle with the needs of your family and your infant in your case. And for those of us who have older children or youth or millennials, God forbid, and are running around in our home, and we're all together, it literally is figuring out a way to create some space. And you can't create space with an infant, but you really do have to, as was mentioned by Dr. Jenkins, put in space for breaks in your home. You have to put in space for meal times and food. And so if there's an extent you can put some kind of structure within your unstructured life now, I would recommend you do it. And for an infant, I don't know how young they are, but depending on how old they are, you can actually socialize them to recognize that you're taking a space time. If you have a computer or you're working from home, if you decorate it in a certain way, mommy colors or family colors or something, then the child can visually see, if they're not able to speak, that you're in an area where you need to take a little downtime. And so whatever you can do to just, again, create the structure and the balance and fit it together. And for those of us that are just now learning all of the finagling things of meetings and online things, for the folks who have older parents or older children, or even school-aged, or quite frankly, grandchildren, I would have fun with it, because we've been on those conference calls with their kids, and the camera goes on, and then your child freezes and looks at each other, is making faces, and I try to tell my husband, they can see you whispering in my son's ear for the answers. You should probably stop. But we just breathe, because at the state level, they recognize that this is going to be a challenging time. The work realizes, and work standards and employers know that there is a sharp decline in productivity. So what you can control within your own homes and life is thinking, like I mentioned earlier in the beginning of the day, is today I want to accomplish this or these things. And think of it in terms of being at home, where you have much more distractions in life, that I would then pare that down to really what's doable. And that will help you manage each day. And if there's anything you can do is really look at a structured way to approach your day. I think it would be very helpful. Again, like others, my kids are lamenting because they think it's vacation/school, but really as much structure as you can do will help us, especially when everything is lifted, to actually gradually return to, quote, normal operations.
Right. Thanks, Dr. Tribble. What would you add to that, Dr. Jenks?
Yeah, I'm living that experience right now. I have 2 children under 5 in my household.
Whoa.
So I have an 18-month-old and a 4-year-old. And so
Aww.
The experience of juggling both work and being a parent and trying to incorporate some type of education is both something I look forward to and is honestly a struggle. As Dr. Tribble said, chunking I think is a great thing. I'm working with my staff, and I have a few staff who have children under the age of 6 months who are trying to figure out how to navigate this system as well. I would say working with whoever your supervisor is to be able to create a schedule that works for you. I've really worked with my team and being able to help them set up time so that they have availability to see their clients, or to, in other people's case, do their work at specific times, and then maybe do paperwork later in the evening, or work with their partner. I mean, there's a sense of privilege in being able to potentially have a 2-parent household where you can work together and set up a schedule where, I have one staff who does all of their work meetings in the morning, and then they switch with their partner, and their partner does all their work meetings in the afternoon. If you're speaking about an infant, though it was just a few months ago, that's burned into my brain, and being able to work around naps. And so really utilizing the natural breaks that are available, making sure that you set up a structure so that nap times are actually going to be consistent because you are home, and really trying to make sure that you're not only working around those naps, but also being able to take time for yourself. As we talked about earlier, self-care is so important. And if you're caring for another individual like an infant, it's going to be very difficult to be able to take time for yourself. And so being able to be like, all right, I know I have a 2-hour nap. Let me do some quick breathing, some meditation, get into my workspace, be able to work, and then hopefully if you have the privilege to be able to go and then take care of your child and break up your work like that, I would suggest. But I obviously know that there are people who have different circumstances, and so just know that everyone is trying their best. The one thing I will say is that Family Pass has a 24/7 parenting helpline for families that are stressed out, and it is anonymous, and I will make sure that that phone number and that resource is available to Sarah.
You'll get that to Sarah. Thank you very much. I've heard it said more than once during this time that parents who are doing that at-home learning, distance learning, helping their children, believe that teachers should be paid way more than we're paying them. I see I see some heads nodding out there. So they identify. One group that I worry about is our seniors, especially seniors who might live at home, might be homebound and shouldn't be going out to do their grocery shopping. So maybe they're getting groceries delivered. But do you have any particular advice, maybe more Dr. Tribble, for this particular group, and how can say others in the community perhaps help them?
Absolutely. I think the first pragmatic thing I will just acknowledge is know that our county is, and as you can probably see on the news, there are a lot of things that are happening in long-term care facilities, even here locally. So
Right.
our behavioral health are literally wrapping around, and we are dispatching teams to help coordinate care and be a support in the midst of a lot of things that are happening. What I would say concretely, knowing that time is obviously of the essence, is what you just mentioned, Mayor Ashcraft, is really important in terms of even if it's getting a meal, even if it's a random hello, how are you? If you do know, or you are a person of who's earned respect on this earth, I'll say, I would encourage each of you to think of a way to continue with the connection. And I would say that not just how are you, and not just hey, I just want to let you know I'm okay, but two reasons. Look, two thoughts. Think pragmatically. If there are any needs that you think that person might have, even if they wouldn't ask, give. Because number one, that reinforces that human connection and that they are not alone. So they didn't ask you, but you bring over a bar of soap. Of course, it'll probably prompt a joke. But whatever that is, or if they really have food needs, or if you and other people, neighbors around you, can pitch in and have a schedule. So maybe there's apps for that. I'm sure there is. I don't know what they are. I have to ask one of my kids, but just really maybe on a couple days a week, you guys pitch in and to help pragmatically what the needs might be, paying a bill, everything. I've lost my parents, but years ago, my parents, especially my mother, my father was a little more apt to, would love to just cash a check, have the physical money, go to the person or write the check. It was just something that helped her to feel better. Well, this is a whole new world. Besides having economic instability about not being able to pay potentially their mortgage or their rent, helping to figure out, is there a way, without elder abuse, but is there a way that you can help create space, or give them a tutorial of an app that they can use for paying their bills, or help them to stay organized and grounded? They don't get to walk to the so again, those are the pragmatic. And the other thing that I mentioned, I just called out, is literally just the human connection, just saying hi. You've seen it on a lot of news programs where people are waving outside. There's a little conversation about the safety in that, but literally I've sent some random emojis, to loved ones of mine, and just to say hello. Hey, guess this is what we're doing, or look at this PSA we just did, or so on the human side. So think human connection, whatever that means for you. Virtual hugs, funny texts, versus spirituality, things you can send them and say hello and connect and call, teaching them FaceTime, that human part, as well as the pragmatic. And that's the part that, we want to continue to raise. And if it's even, hey, have you checked your temperature? Did you know there's an app for that? I'm making it up, but just really both human and pragmatic, what I would recommend for our older adults. If you're around them, to support them. And if you are one, think of, are you taking care of those two domains for yourself?
Thank you very much. And I see that we have come to the end of our hour, and there may still be questions that weren't answered, but Sarah, maybe there's a way we can get them out to our experts, or if they're for me, and we'll get them answered.
Yeah, we can actually, in the event portion of the website, we can add the answers to the comments. One question for Dr. Tribble really quickly. This is somebody who was following up on the very first question that was posed, which was talking about our unhoused resident who has become violent. They said they looked up on the internet the county crisis support services, and it looks primarily like a volunteer staff suicide prevention line. Is there something more specific to help with schizophrenia, alcoholism, things like that, who are not sheltering right now at all?
It actually is the same line, and you can't see it, but I'm looking. Our director for Crisis Services Division, Stephanie Lewis, is actually on the call, but it's all the same. And what we try to do is there's a portal, so those individuals can be dispatched, and her team really goes out and they can make a determination. So sometimes it's voluntary, which is our hope, and that's how we really promote that individual freedom. But sometimes they are able to make determinations. And we do have actually clinicians that ride along with law enforcement. We do actually have clinicians, it will soon be starting, embedded with our EMS. So really it's all hands on deck. So that's just a phone number line. It's a very soft way, but really we have mobile crisis that can literally go into the community and can make a determination, voluntary or not, if they need to be helped.
Thank you, Dr. Tribble. And I was making a note in my margins. I'm taking notes, which is one of my habits, but I'm going to share this information with our police chief because that's valuable information to know. So with that, I want to thank Dr. Karen Tribble, Dr. Cale Jenks. Your information has been invaluable to us at a time like this, and I hope the audience who was listening and some asking questions got as much out of this as I did. And please, everybody, don't hesitate if you would not be alone to be feeling anxiety and all kinds of emotions that are maybe not usual to you. So reach out for help. The help is there. And as Sarah mentioned earlier, if you go to our website, alamedaca.gov, and choose the COVID-19 link, you will find valuable information, including from this session today. So please join us next week. We will get the exact time, but our guest will be Congresswoman Barbara Lee. And by then, I'm hoping she'll have some federal funding to tell us about, but again, another opportunity for you to stay informed and to have some of your questions answered. So until next time, everyone, take care and stay safe. And thank you again, Drs. Tribble and Jenks. It was lovely to have you.
Be
Bye,
well,
everyone. Take care. Thank you.